All right, good afternoon, Harlem Children's Zone family. Uh, I'm the CEO, Kwame Owusu-Kesse. I'm really excited to be able to be with you all this afternoon. Excited for the discussion. We have two very special guests that will be joining us to be able to have a much needed conversation about the vaccine. But first, I wanted to be able to talk a little bit about our response to COVID. And as you all have heard me say a number of times, the Harlem Children's Zone is playing a leadership role across the country for our response to COVID-19. It is a pandemic like we have never experienced before, and we know the devastating toll that it is having on communities of color all across this nation. And as you all know, we sprung into action and were able to develop a comprehensive approach similar to our comprehensive model, knowing that if not us, then who? And we know we needed to be able to mobilize the necessary resources on behalf of the children and families that we serve. And as a quick update in terms of what we've been able to accomplish to date, here on the ground in Harlem, we've distributed over $3 million in emergency relief funds. We've also distributed about 100,000 pounds of fresh produce to our community. Additionally, about 2,000 thermometers, 2,000 laptops. We've launched our Stay Covered Together campaign that have had millions of impressions and have had so many other supports provided to our families when we're talking about wellness supports, our partnership with Crisis Text Lines and others. So really, really Herculean effort that you all have been able to do on behalf of our families on the ground in Harlem. And when we take a zoom out and think about what we've been able to accomplish nationally, we, alongside of our partners in Oakland, Minneapolis, Chicago, Detroit, Atlanta, and Newark, have been able to distribute over 250,000 masks, about 30,000 plus laptops, and additionally have been able to launch a national Stay Covered Together campaign that as well has had over tens of millions of impressions. So again, we are showing the country what we can do when we take on this responsibility of leadership for our community. And as you know, one of the pillars of our approach was this idea of protecting the most vulnerable. And we believe this afternoon's conversation fits squarely within that framework in terms of protecting our community. We know across the country, over 500,000 lives have been lost to COVID. And there's a lot of fear with regards not only to COVID, but a lack of information available about the vaccine. And we all have our questions. And the goal of today's conversation is to engage in an honest conversation with the experts. And I must say that we all come from different perspectives, and there's different viewpoints that we bring to today's discussion. And some of us may have had terrible experiences with healthcare professionals, and I just want to be honest and sincere about that. We've all have experienced in one way, shape, or form different microaggressions that leads to a certain level of distrust. And we're seeing that play out all across this nation as well. Additionally, we have individual fears about our life decisions and how that might impact our families and our lifestyles. And so there may be some hesitancies or concerns or myths or theories that have been percolating throughout the community and wanting to get to the core of it. So this is appropriately titled Just the Facts, so that we're able to ask the medical professionals in their honest opinion, the truth, and be able to separate the theory and conspiracy theories from the facts. I should state that I have been fully vaccinated. So this is something that I truly believe in. And it was a decision I made that would allow me to help protect myself, help protect my family, and put me in the position to be able to be in the office every day, working on behalf of you and our children and families. So I would like to take this opportunity to introduce our two esteemed guests. First is Dr. Iyasere. She's the Executive Director of the Dalio Center for Health Justice at New York Presbyterian. In this role, she leads the center's efforts to address longstanding health inequities due to race, socioeconomic differences, limited access to care, and other complex factors that impact the well-being of our communities. Next, we have Dr. Olajide Williams. He's a tenured professor of neurology and associate dean of community research and engagement at Columbia University. He's a global leader in health disparities, a principal investigator of multiple NIH Investigator Initiative Awards, and co-chair of Columbia University Medical Campus's Anti-Racism Task Force, and the Academy of Community and Public Service. So doctors, welcome. Really excited to have you here with us. Really excited to hear from you all and ask all of the questions from our community. So Dr. Iyasere, maybe we can begin with you, and if you can talk to us a little bit about your work and why a conversation like today's is so important for our community.
Absolutely. Thank you so much. And thank you for having me here today. I think I completely echo your sentiments that this should be a conversation. And I think that we all come to these conversations with different history, with different challenges, different questions. And I think it's important that everyone feels that they have an open space to bring up or raise those issues. So no question is off limits. If I don't know the answer, or if Dr. Williams doesn't know the answer, we will get you the answer and we will follow up with you, because it's important that we tell you when we don't know. And there are a few things about the COVID vaccines that we're not sure of yet, and we want to be honest about that. But I think, as I said, it's important that we recognize that people come here with a different history. I will tell you, I am a practicing physician. I was seeing patients during the height of the first wave of the COVID pandemic, and was, in our emergency room, in our inpatient setting for much of March, April, and May of last year. And I think for a lot of us, what we saw day in, day out was really traumatic. You saw a lot of people, a lot of Black and brown people who were very sick, and unfortunately, many people who died. And for me, being vaccinated and sitting down in the chair was a highly emotional experience. I cried during my first dose and my second dose, and not because it's painful. I cried because I was overwhelmingly relieved that we now had something where I look at it as the light at the end of a very long tunnel. I was so excited by the prospect of saving people. And I thought about all of the people that I had cared for that I wasn't able to save. And I thought, this is something that we can do to really make a difference. So I come here today because it's a personal passion of mine to make sure that we support everyone in this decision. And it's also what my job is. So when I go to work every day in the Dalio Center, my job is, how do I make health and healthcare better? And vaccination is one of those ways. So again, I'm very happy to be here today, and we will try to answer openly and honestly all of the questions that you have. I am extremely privileged to be joined by Dr. Williams, who I have been on panels with before and who is a colleague and friend of mine for many years. So I know the next is to have Dr. Williams say a few words, but it's always a pleasure for me to share the stage with him as well.
Wonderful, thank you. Dr. Iyasere. Dr. Williams, why don't you share a little bit about your perspective and why you think today's conversation is important, and a little bit about your work and practice?
Yes, thank you. Well, first of all, Kwame, I just want to say that I'm equally honored to be sharing this stage with Julia. We go back a long, long way to the days of our residency, so it's nice to see both of us at this stage in our lives. But I also want to give you a special shout out, and to the staff and team at Harlem Children's Zone. I think just your opening remarks, it's just incredible what you guys have accomplished and the support you give our communities. The phenomenal work that you've done in supporting our communities through such probably one of the most difficult times in our recent history, and for Harlem Children's Zone to take such a leadership role and to accomplish the things that you have accomplished, and to partner with the community the way you have partnered with the community is nothing short of commendable. So thank you for the incredible work you're doing. We are all part of the same community here. And we are all seeking the same goal, and the goal that we're all seeking is wellness. My father always told me that health, that achieving health cannot be accomplished by physicians, that it takes a whole village to achieve health, because health is more than the absence of disease. Health is the presence of wellness. And I've always lived by that rule, and I've always recognized the need to partner with organizations in the community to achieve health, which really is the presence of wellness. And so that's what we're really here to talk about, is how do we achieve wellness? How do we maintain wellness so that we can all continue to live fulfilling and productive lives? I wear several hats at the university, at the hospital. Like Julia, I was also a clinician on the front lines. I ran a COVID unit on the 8th floor, and I saw a lot of the same things as she saw. And we will never forget. We will never forget the stories. We will never forget the people. We will never forget the families, the brothers, the sisters, the mothers, the grandparents that died in our midst, in our hands in some cases. These are not statistics. These are real people with real lives that were taken by a devastating disease that we can now prevent through vaccination. And so while I think it's really important to understand the concerns and the caution, and in some cases the suspicion over these vaccines, I think that it's all the more important to make sure that we not only acknowledge the realities that have caused these concerns, that span the history of this country, and are still present today. I mean, people talk about Tuskegee, but we don't need Tuskegee. We had, just last year, how many Tuskegees did we have at the hands of the police? How many Tuskegees have we had at the hands of the marginalization and the consequences of the marginalizations that people of color have experienced in this community? We don't need Tuskegee. Tuskegee still occurs today. And these are the things that are driving the current movement to try to address structural racism in this country. I take my hat off to the Black Lives Matter movement, the fight that's been picked up in all four corners of this world. But this is a fight we have to sustain, because it not only has direct implications on our dignity, it also has direct implications on our health, and the threat that our health faces today in the presence of COVID.
Wow, that was very powerful. Thank you for that. And I actually want to build on one of the points that you made, and probably direct this question to you, Dr. Williams. Came across the term trauma-informed vaccination education, and this idea of putting into the historical context and the relationship, particularly of communities of color, and the trauma that we've endured through the distrust for generations that's happened with the medical community. From your perspective, how important is it to hear medical professionals and other folks that are advocates of vaccination to be able to approach it with a trauma-informed lens and be able to address what you just articulated?
No, that's a great question, Kwame. And I just want to begin by, there's a lot of demonization that takes place in this country. A lot of people want to blame other people. We want to blame people. And I've always been very concerned about when we use the word hesitancy and we say this group is a hesitant group. What's going to come next? You're othering a certain group of people. You say they don't want the vaccine. You're othering them, and there's a very fine line between othering and all the discrimination that comes with othering, and it happens when we don't really understand, when we're not proximal to those individuals who are having concerns. And that's why trauma-informed approaches are critical. And so when we look at hesitancy, it's important for us to change the conversation from what is wrong with them. What is wrong with these people? Why can't they just accept the vaccine, and change that framing of what is wrong with them to what happened to them? What happened to them? And that right there is the crux of trauma-informed care, changing that framework. So what happened to them? And if you ask the question, what happened to Black America? Why are they concerned or suspicious or reluctant to embrace a vaccine? You have your answer right. We can give you thesis upon thesis, narratives upon narratives about why what happened has created this reluctance to just pounce on a vaccine that was just produced. So it's important to first recognize that using the word hesitancy runs the risk of othering people, of creating walls around groups and saying these folks don't want to get it because of X, Y, and Z, and ask the questions. Why are these particular groups concerned about the vaccine? And so trauma-informed care is really approaching things through that lens. It's that open-mindedness. It's that compassion that all people deserve, because anyone can have a history. Anyone can have a history that impacts their encounter with the medical system. And so that is the key. And when you look at communities of color, you see a sea, an ocean of trauma, that really rippling through the underbelly of Black America is just trauma, blood and pain and the sweat that is the result of discrimination. And look, I don't want to talk about the past, because even in the present, even as a practicing physician, Julia will tell you that there is still tremendous bias, implicit bias in the health system that we are still struggling to root out. And so there is no question that we all as a profession need to embrace that trauma-informed approach that will allow us to empathize and respect the opinion that other people have.
Got it. Thank you. Dr. Iyasere, I would love your perspective on the question, particularly given managing paradox, right? Where Dr. Williams just articulated, there is still massive amounts of bias that exist in the medical system. And how do you balance the existence of bias with being able to provide the real facts and the importance of something like getting the vaccine for COVID-19?
Well, I think that's why it is so important that you did title this Just the Facts, that we do root everything that we talk about in verified truth information, and that we're very clear about helping people to make a decision and not coercing people to make a decision, because there is bias in our healthcare system. We know that. We've studied it for years. There's a massive wealth of literature that looks at this. So I think that when we are supporting people to make a decision, when we're entering into a conversation with them so that people feel engaged, that they feel like they can ask the questions, that they can actually say, this might not be right for me, and to still feel supported, that's how we begin those dialogues. I think it's also important that Dr. Williams and I are here. I think it is important that Black and Brown communities see Black and Brown physicians who know the literature, I have colleagues who have been in the trials, who have helped run the trials. My family has all been vaccinated. And I think it's important that we use our own stories and personal histories and own traumas and own experiences to really be open about what some of the current challenges are. And I think for me and for a lot of the work that I do, we are building bridges, not just for now. This is not just a one-time, we're here to talk about a COVID vaccine now. This is what are we going to be doing which is different in the future? How do we rethink our healthcare system and the delivery of care? Because, and I'm sure someone is going to ask the question of, are we going to need a COVID vaccine again in a year or in 2 years? And so that's why this is the beginning of a conversation. It's not a one-stop shop where I feel like I've won if I walk away and two people say they're vaccinated. No, I feel like if we've engaged in a conversation, we've opened up a dialogue, and we've been able to listen to how people really feel and what the true challenges are, that's when we've won.
Got it. Well, as you know, we've been able to source a number of questions from our colleagues all across the organization. So I would like to take this opportunity just to dive right into it. And as we mentioned earlier, no question is off bounds. So I want to start with probably the most basic question. And this could be open to any one of you to answer. What is a vaccine?
So I'll go ahead and take that one.
Yeah.
And you can think of it as, and I will also try to add in a little bit about the vaccines that we have now, because they're slightly different. But essentially, a vaccine is a way to tell your body to have an immune response. So essentially, in the case of Moderna and Pfizer, your body is delivered a little message which says, I want you to create antibodies against coronavirus. The way in which Moderna, Pfizer, and Johnson & Johnson do it is slightly different, although again, it's really very similar, that we're using your body's immune system to develop a memory. And that memory is what protects you from a coronavirus in the future. So your message says, make antibodies, and they sit around in your system. You develop that memory. It's an immune memory. And so if I then get coronavirus, so if someone around me is sick and I'm exposed to coronavirus, I already have that memory in my immune system. I already have the fighters ready to combat that virus. They just lay in wait, waiting for you to be exposed to a viral infection. So you can think of it as a vaccine is a way to deliver a message to your body to say, create an immune memory, so that if you find this virus in the future, you already have the ability to fight against it.
It's like a mugshot, right? It's like a mugshot. It's like you put the virus on a mugshot, and you take that mugshot into the body, and you say, hey, most wanted. This is the most wanted. And then the body says, okay, we got this, right? And then as soon as it appears, you got a whole bunch of law enforcement just ready to pounce, because we recognize the mugshot. And those law enforcement forces, those soldiers, those are our antibodies. And the mugshot that's presented, that's what the vaccine does.
Mm-hmm.
All right. Oh, go ahead, Dr. Iyasere.
I'm sure I know one of the questions is that we get a lot is, how were they created so quickly? Yeah. And I think that dovetails really nicely with what is a vaccine and how does it work? So I like to think of them, and they're slightly different. Johnson & Johnson is something called a viral vector, meaning that we took a different virus, not coronavirus. We modified it so that we could use it to deliver a message. But again, I'm saying the same thing, deliver a message. The Moderna and the Pfizer vaccines, slightly different, but they do the exact same thing of deliver a message. So I like to think of all three of them as a message in a bottle. The way what the bottle looks like might be slightly different between the three of them, but they ask your body to do the same thing. And the message they give you is, create a protein that looks like coronavirus. And I'm going to say it again, create a protein that looks like coronavirus. There is no coronavirus in any of these vaccines. So there is no live coronavirus in any of the vaccines. Again, it's a message that tells your body, create a protein which looks like it. And then when you made that protein, now have that immune response. Now create the antibodies and save those, so that if I do see coronavirus, that mugshot was already there. And I'm ready to fight if I have to. Well, the reason we were able to make these vaccines so quote unquote quickly, and I'm just gonna say quote unquote because they really weren't made that quickly. We knew how to make that bottle. I said it's like a message in a bottle. We knew how to make the bottle a long time ago. They spent years figuring that part out. We knew how to make the message. The mRNA vaccines you hear about with Pfizer and Moderna, the research to make those started in the late 90s. So we've been working on this for years and years and years. And then guess what? We tried it before. So the Zika vaccines were created the same way with mRNA technology. We just didn't use them in the United States. There was an Ebola vaccine, which is exact same technology as the Johnson & Johnson vaccine. We just didn't use it in the United States. So we knew how to make the bottle. We knew how to make a message. All we had to do was change what the message said. And that's how we really got them so quickly, is because we just had to make some modifications to what we already knew how to do. And then when you looked at the clinical trials, we staggered them. So you overlapped phases of the clinical trials. But it means that no steps were ever, and no steps in safety protocol, in review, none of it was ever skipped. It's just that we overlapped the phases. There's 3 phases. We overlapped them in the clinical trial. But they understood if there's ever a side effect, if there's something that's concerning, the whole thing has to stop until we evaluate it. And then I think one of the really key things that was done and was decided early on was that while the clinical trials were still going on, they would start manufacturing the vaccines. And there's actually, if you go back, there's a, Tony Fauci is talking about this specifically. And he said, listen, if we find out that these vaccines don't work, I'd rather throw away all the vaccine that we created than have to wait 3 more months and have people getting sick with coronavirus. So manufacturing started early, the phases of the trials were overlapped, and we had decades of research going into this, which is how we got down to that 1 year. But again, I'll say it again, no safety standards were skipped, no phases were skipped, all of the same protocol was followed. It was just everyone is now focused on doing one thing and doing that one thing really well, which is get a vaccine from development to market safely and effectively.
I just want to clarify one point just to make sure I heard that correctly. Did you say that there is no live virus in the vaccine?
These vaccines, Johnson & Johnson, Moderna, Pfizer, do not contain live coronavirus. There is no coronavirus in all 3 of the vaccines. They also, again, no live coronavirus in any of the vaccines. And also these vaccines cannot change your DNA. Those are the 2 questions I think people usually put together for me can I get coronavirus from these vaccines and can they change my DNA? And the answer to both of them is absolutely no. You cannot get coronavirus from these vaccines and they will not change your DNA.
Okay, so Dr. Williams, maybe I have a question for you. So I get the message in the bottle, the mugshot, I see all those analogies. If each of the 3 are giving the same message, why is there different effective rates that are talked about in the news?
Well, I mean, honestly, we have to forget about the different effective rates. We just have to eliminate that because the trial designs were all different. The trials, the methodologies, the measures, the things that were used to like evaluate its so-called effectiveness were all slightly different across the different trials. So what I tell people is they're all effective. They're all incredibly effective, more than 90% effective at preventing hospitalization and death. And those are the 2 most important things. If you think about it, when you get sick, if you have a little cold, right, you can still, you're still okay, right? A little mild cold, sneezing, you're fine. The problem is when the cold is severe enough to cause hospitalization, right? That's when the disease is severe. You're hospitalized for the disease. There's sickness and debilitation and lost wages, et cetera. And then you can die. All 3 vaccines are incredibly effective at preventing hospitalization and death. And so what I tell my patients is that if you have the chance to get any one of those, grab it. Just grab it because they're all going to keep you out of the hospital and they're all going to prevent you from dying from the disease.
So you made an important distinction. You said very effective against hospitalization or death. But can you talk to us a little bit about the questions that folks may have in terms of, will the vaccine prevent me from getting COVID-19, period?
Yeah, I mean, yeah, they're all very, very effective also at preventing you from hospitalization and death. Now, I just want to make this point. You can still be COVID positive even if you're vaccinated. The issue is you won't get sick from it. So you can still be positive. You can still have the infection, but you won't get sick from the infection. And that is really, really important. And it's also a reason why we all need to get the vaccine. Because I've been vaccinated, Julia's been vaccinated. If I, for some reason, I'm in a patient's room and something happens and maybe my mask comes off or something happens and there's massive doses of COVID in the air and droplets are flying all over the place and I'm vaccinated, I can still get it. But if I get it, I won't get sick from it. That is the guarantee of the vaccines. If I won't get sick from it. But when I get it, another thing that the vaccines do, one is the vaccine reduce transmissibility. They reduce my infectivity. So even though I can transmit it to someone else, that transmissibility is greatly reduced. But what is important is that I won't get sick, right? And the reason why we still have to wear our masks, even if we've been vaccinated, is because of that theoretical risk that we can still be infected, but not get sick. So this theoretical risk is not something that we really see, but there is, I mean, that's very rare cases, but there is this theoretical risk that we can still be infected without getting sick. And that's why we have to continue to wear our mask until everyone is vaccinated. Because if we are still theoretically, carrying the virus and can transmit the virus, we just don't get sick from it. We could come across an elderly person who is unvaccinated, who is vulnerable, and that person can be at risk from us if we're not wearing a mask and if they're not wearing a mask. So that is why we need to get to what we call herd immunity, right? We need to get everyone vaccinated because the only way for the virus to peter out, of our society is by everyone being vaccinated. So if I'm vaccinated and Julia's vaccinated and the virus comes in to a vaccinated person, first of all, it's going to have a very hard time infecting us. Secondly, we're not going to get sick from it. And thirdly, our infectiousness is very low. And so after a while, if you have a bunch of people like that in society, the viruses are going to have nowhere to go, and it's just going to peter out and fall away from society until it doesn't exist in our society in the type of numbers that can cause the type of pandemic that we see. And so, yes, absolutely. These vaccines are going to protect me from getting hospitalized and dying. Yes, theoretically, I can still be infected, but what is important is that I won't get sick if I were to get infected, which is why it is critically important for us to continue wearing masks until we have enough people in the community that have been vaccinated.
All right. Well, Dr. Iyasere, I think I'm young. Relatively healthy. I haven't caught COVID yet. Why would I then run the risk of taking a vaccine if I've been fine for the last year?
So a couple answers to that. One is exactly what Jide was just talking about, that we really need to do this as a community. So the way that we get out of a pandemic, the way that we save people's lives across the world is that we all do this together. Because if half of us get vaccinated and the other half don't, you'll still have coronavirus in the community. So we'll still have to wear masks. So even though my individual risk of getting coronavirus is low, or my individual risk of getting sick from coronavirus is extremely low after I've been vaccinated, it's still there. It's not 100% effective. But when we get to community immunity and we see that the rate of transmission is extremely low just in the entire community, well, that's when things start going back to normal. That's when you don't have to wear a mask when you're going outside, or you can fly to go see family members and not really worry about it as much. That's when you can see your grandparents, or you can feel comfortable hugging your kids and not worrying that you may end up giving them coronavirus. So there's a community effect to it. But then there's also the very real effect that I know young people feel invincible. I did when I was young. I'm not going to say how old I am, but I'm not young anymore. And you feel like you don't have medical problems. You may not be concerned about it, but I can tell you firsthand what we are seeing now is that young people are getting sick with coronavirus. It is not discriminatory when it comes to age. We see people that have very severe side effects from coronavirus, that have strokes, that have some of the neurological conditions that you can get, and now are debilitated for the rest of their lives. And these are people that didn't have medical problems. These are 20 and 30-year-olds that were previously healthy. So coronavirus can affect any age, can absolutely affect young people. It's definitely not as high of a risk as someone who has multiple medical problems and who is elderly, but that risk is still there. So I think when you think about it, and when people ask me like, well, what are the theoretical risks of the vaccine? I say, well, just compare that to the very real risk of getting coronavirus now, like the very real risk that you could get sick, that you could end up in the hospital. So, I think for younger people, with some of the newer variants that have been coming up, we actually are seeing that there's younger people that are getting sick from coronavirus. And then as just to reinforce always that the way to get back to, a quote unquote normal is that we all do this together. This is a community event. We all have to be vaccinated to get to community immunity.
Got it.
Just want to add to that because I think it's important to talk about the variants at this point because if the longer the virus stays in the community, let's say we have half of our young people refusing to get vaccinated, then the more the virus replicates in our bodies. And the more the virus replicates in our bodies, the more chances that there are to have a mutation of a virus that causes a variant. So by vaccinating, we reduce the viral replicating. By reducing the virals from replicating, we reduce it from mutating into one of these variants. And what we are terrified about as a medical community is we are scared of these variants because we are the doomsday scenario, God forbid, is that we find that a variant starts to develop in an unvaccinated cluster, and that variant evades our immune system and our vaccines and causes the pandemic to start all over again. And then it spreads across society all over again, and we're back to square one. That is the doomsday scenario. That is why there is a race against these variants. There's a race to get vaccinated. That's why we're putting all this energy into we got to get vaccinated, because if we don't vaccinate everybody quickly, we are running the risk of one of these variants popping up that the vaccine is not going to work against. And then we're back to square one.
I just in the chat, I put in, we have a short video, it's about 2 minutes long, that explains what a variant is and how it can lead to different forms of coronavirus. I just saw in the news, for the past couple of days, there's a double mutant, which is now in Northern California, meaning that it has 2 mutations. And we've been very lucky that the vaccines that we have been able to cover the variants that have been popping up. But I really absolutely second what Jide is saying, that the more time that we give these viruses to mutate over and over again, they will hit on something that evades the vaccine, and we have to start over. So, I think this is the prime time. We have the opportunity. We have the vaccines available. They are working. They are highly effective. We should absolutely capitalize on that.
Got it. Another question that we've been receiving a lot is this question about family planning. So what if me and my wife are planning to have a child, or if I have a staff member that is pregnant? What's your recommendation as it relates to getting the vaccine?
Well, the CDC recommends that pregnant women or people who are breastfeeding should be vaccinated. But they also say, though, that it's important to have a discussion with the healthcare providers before making the decision. And there have been, there's a database of pregnant women who have received the vaccine, and from what we know, they're all doing well. So yes, it is a recommendation. One of the things about pregnancy is that it puts you at risk for severe COVID. A lot of people don't realize that the pregnant women are actually a high risk group for developing severe COVID. It's like people with diabetes, a high risk group for developing severe COVID. People with obesity and heart disease, a high risk group for developing severe COVID. Pregnant women are also a high risk group for developing COVID. So the CDC recommendation is to offer pregnant women and all breastfeeding women vaccination, but do it in conjunction with the discussion with your healthcare provider. Yeah, go ahead, Julia.
Just to comment a little bit further on, so there have been no documented or even in knowing how the science works, no concerns about fertility, both male and or female fertility. And so the recommendation is that if you are planning to become pregnant, you should be vaccinated with your risk group. So if you are eligible for vaccine and you are planning to be pregnant, you should be vaccinated. If you are currently pregnant, that's where the conversation is. It's a personal decision. And there's a couple reasons for that. One is that pregnant women were not included in the original clinical trials. And this is not something which is rare. Like, this happens frequently. Many times pregnant women are not included in clinical trials. So what we have to do is look for other data. So all three vaccines, Johnson & Johnson, Moderna, and Pfizer, have been tested in animal models for pregnancy and have all been shown to be safe without side effects. We also know that the Johnson & Johnson vaccine, which I already told you was modeled after an Ebola vaccine, that vaccine was used in pregnant patients years ago. And so we saw in pregnant patients with that Ebola vaccine that there were no side effects. Knowing what we know about the science, so knowing about the way the Moderna and the Pfizer vaccines work, the way the Johnson & Johnson vaccine works, we do not expect side effects or any effects on pregnancy, but it wasn't specifically studied in the trial. So that's why people say, engage in the conversation with your primary provider, with your OB. However, the American College of Obstetrics and Gynecology, which is like the national governing body in the United States for OB care, has said that, if you should be offered the vaccine. And you can talk to your provider about it, but you should be offered the vaccine.
Got it. I just want to pick up on two things that you both have mentioned. So Dr. Williams, really quickly, you mentioned other risk profiles in terms of diabetes and others. Is the recommendation for folks that might be in a high risk profile for COVID to also get the vaccine?
Absolutely. Critically, and this, unlike pregnant women, this was included in the clinical trials. There was a large group of patients with comorbidities deliberately included in the clinical trials, and the vaccine was safe in these groups. What is more important, though, is that, safety obviously is critical. That's number one. And the vaccine has been shown to be safe in these groups. But what is more concerning is that people with these high risk conditions are at more risk for severe COVID and from dying from COVID. I mean, Julie and I can talk to you all day about the people that we lost in the hospital. Most of these people who died from COVID had what we call comorbidities. They were high-risk patients that had diabetes, obesity, heart disease, et cetera. And they're the ones that we were seeing that were dying from the disease. They had much more severe disease, which is one of the reasons why those individuals with these conditions were actually a priority group. Here in New York State and across the country, they were considered a priority group to get vaccinated early before it becomes available to the general public. So absolutely, if you have one of these conditions, please get vaccinated. My 85-year-old mother, who has multiple comorbidities, she got vaccinated right away. And she's doing absolutely wonderfully, as are millions of people in the United States right now who've been vaccinated and have these comorbidities.
Got it. And Dr. Iyasere, you had mentioned about who was included in the clinical trials. Were people of color, and more specifically Black people, included in the trials?
So, and I know that I've been on a panel before, and I'm gonna half answer, and then I'm gonna have Dr. Williams talk about a little bit more about sort of like the governing national body for Black physicians and what they have said about it, because I think it's an important point. So yes, I think specifically the numbers in pretty much all of the trials were around 10% Black African American. I think it was a little bit higher in the Johnson & Johnson, but Moderna and Pfizer were 10%. And although that doesn't, I think national census data shows us that Black African American people make up about 13% of the US population. Generally, it's dependent on where you look. In New York City, it's probably more like 19 to 20%. But 10%, although being under that like average of 13% across the country, is actually a very good number when we look at clinical trials. And I think this gets back to what I said in the very beginning, that we know people who were running the clinical trials. We know people that were in the clinical trials. I know Black and brown people, physicians that were in the clinical trials. And I know the concerted effort that all of the trial leaders made to make sure that they had representation of Black and brown people in all stages of the clinical trials. So, Dr. Corbett, who I think a lot of people have seen, was really leading the way for the Moderna trials. As I've already told you, I've been on panels and have colleagues of mine that have been in the Johnson & Johnson or in the Pfizer trials. So I feel very comfortable with the representation in the clinical trials. I think that it is reflective of our community. We can always do better, always do better. However, I think the numbers are quite good. And I know what Dr. Williams is gonna say about the National Medical Association, so I'm just gonna pass it over to him because
I know beyond the nationals, if you look, so the first wave was healthcare providers. Remember that we were the ones that went first. We were the ones that were asked to go first. It's very unusual, right? Because with most vaccination drives, it's the most vulnerable people that tend to go first. But in this situation, we went first. Now, there are thousands and thousands of Black and brown physicians across this country who were part of that first wave of vaccinated. We were all vaccinated back in December. I was vaccinated back in December. We're in April now, right? Julia, I'm sure, was vaccinated, but we were all vaccinated back then. Thousands and thousands of Black physicians and doctors, and we're doing well. But more than that, the governing body of Black physicians, which is the National Medical Association, which all Black physicians, most Black physicians are members of this governing body, they independently were asked by the FDA to independently review all the clinical trial data prior to the approval of the vaccines. And they put expert Black leaders, scientists together that reviewed the data, and they said, yes, this is safe for our people, because they are the guardians of Black physicians and the guardians of Black America. They fought in the civil rights movement. They fought for equal access to care. The American Medical Association said, we don't want Black doctors as part of us. We're only taking white doctors. So the National Medical Association was born out of that discrimination and said, okay, we're gonna have our own society since you don't want us. And that's how the NMA was born. It's been fighting for civil rights in the Black community since it was founded in the fight. And this is the same organization that reviewed all the data and said, yes, this is good for our people. And there is no greater endorsement than the National Medical Association, who are the NAACP of medicine, to endorse the vaccine for our people. So it is safe, and Black, brown, white, wherever you come from, there are independent bodies that have evaluated it and attested to the fact that it is safe.
Thank you. I want to be mindful of time. We have about 5 to 10 minutes left. So I want to rapid fire some questions. So feel free to jump in. So the first question I have is, if you have previously been impacted by COVID, do you still need to take the vaccine?
Yes.
All righty.
Yes.
Yes, I had COVID. Okay, full disclosure, I have had COVID, very sick, got it when I was working on the front line, and I've been vaccinated, and there are many like me who have been vaccinated and who've had COVID.
Got it. Is there a timeline?
Very quickly, I'll 30-second answer to this one.
Yeah.
Even if you have had COVID, you do develop antibodies to COVID. Yes, absolutely. We don't know how long those antibodies last. We don't know how good they are. So the recommendation is that you still get vaccinated, because we do know those antibodies are effective. And I know that when we're looking at how long they are effective, people are still in the original trials to look at how long those antibodies last. We know at least 6 months. We're still going to keep testing over and over the people in the original trials to know when you have to get another vaccine. But if you've had coronavirus, some people have antibodies that last a month or two, some never had antibodies, and those antibodies aren't targeted in the same way to that spike protein, which is the necessary part of the coronavirus to cause infection. So vaccines are targeted immunity. We know the effectiveness, and we know how long they're going to last in the studies. So if you've had coronavirus, you developed antibodies to it, the CDC says you can wait up to 3 months before being vaccinated. But our recommendations at the hospital are that, after you are off quarantine, so 10 days after an infection, you don't have any symptoms, you're afebrile, you're feeling okay, we actually vaccinate in our system.
All right. When will kids be able to get vaccinated?
That's a good question. So there's been some interesting data that literally just came out. I don't know if you've been following the news, but very recently, as of March 31st, the results of a phase 3 clinical trial, which is generally the last step before a vaccine can really be offered for emergency authorization usage. So as of March 31st, Pfizer actually announced that adolescents between the ages of 12 and 15, actually the vaccine was shown to have demonstrate really robust antibody responses and 100% efficacy, which really exceeded the results that were recorded of their prior participants of between the ages of 16 to 25 years old. So that trial included about 22,000, just over 2,200 kids between the ages of 12 and 15, and it was shown to be effective. So for 12 and above now, we're going to start seeing vaccination rolled out. Pfizer also announced that it had started a global study to look at the safety and efficacy of the vaccine in children aged 6 months to 11 years. And so we're going to be following that to see the results of that trial. But as of now, there is data to support vaccinating those who are 12 years and above.
All right. What are the short-term and long-term effects of the vaccine?
Short-term, arm pain. My arm hurt after I was vaccinated, fatigue. There have been reports of people feeling nauseated. I think we've also seen some low-grade temperatures. Those are the general symptoms that people have after vaccination. If you are getting a 2-dose vaccine, Moderna or Pfizer, we have seen some people report that the second dose might be slightly more than the first. However, both are considered to have mild symptoms, and they all generally resolve within 48 hours. Long-term effects, we really haven't seen a long-term effects. The vaccines in general have now been used in millions of people, and we have seen very few side effects, and they're considered extremely safe. So that we really look at side effects within that first couple of days after vaccination.
Okay. What if I decide to live a healthy lifestyle and eat the right things and drink the right things? Can I avoid taking the vaccine if I have this holistic approach to health and wellness?
You should still get vaccinated. You should still get, we have super athletes who've come down with COVID and died from COVID. I've had patients who are the poster child of perfect health die of COVID. And so, yes, you should still get vaccinated.
Absolutely.
All right. And should we anticipate having to get vaccinated multiple times once the antibodies, after the 6-month period or so?
So we don't know if it's going to be annual. We don't know if it's going to be every 2 years. I think it's safe to say we will need another vaccine. I just don't know. We're not sure yet how quickly that will be. And it gets back to that question about the variants. So if we see that a variant emerges that is not that, and our vaccines are not as effective, it would mean that we have to have another series more quickly than we would want. So right now, the studies have shown up to 6 months. We're continuing to follow to see, does that extend to a year? Is it longer than a year? We don't know that answer just yet. But it is also another reason why getting everyone vaccinated more quickly is part of this sort of public health initiative, because it reduces the number of variants, which then in turn reduces how quickly we need to give booster shots.
All right. Well, for each of you, if I gave you 30 seconds, could you please tell our audience why you believe it is important to get the vaccine?
Well, I see vaccination as, I see it through two lenses. The first is it's personally beneficial. It protects you from getting sick. And by protecting you from getting sick, it protects your loved ones from getting sick. Your grandmother, your mother, your children, your coworkers. And so there's the immediate benefit to you and your family by getting the vaccine. And COVID is deadly. It's taken too many lives from us, too many lives. And you want to protect yourself. And the second thing is getting vaccinated is a community service. Right? It should be looked at as a community service, because by getting vaccinated, you are contributing to community immunity. And the only way that we can climb out of the darkness of this pandemic is through community immunity. We all need, at least 80 to 90% of us need to be vaccinated for this pandemic to end. So you are also, in addition to the personal benefits, there is also a societal, local community benefit from vaccinating.
All right. Thank you so much, Dr. Williams. Dr. Iyasere?
And how hard is it to follow that? So I will just say, I agree. I think about it in the same two lenses. I think simply it can save your life. So getting vaccinated can save your life. It can save the lives of your loved ones. And it gets us back to a society that's functioning, that's working, where people are able to go back to school and to their jobs. It gets our economy working again. And I don't think we can undersell how drastic this has been to our economy. We have lost lives, families, friends, loved ones, but the effects of having our economy be slowed down for so long also has lost lives and loved ones and family members. So the vaccine can save your life. It can save your family's lives, but it also can get our economy going again so that we can again save people's lives, get food on the table for people, get kids back in schools. And I think for me, it's a double hit. It's a win-win for everybody.
Yeah. Dr. Iyasere, Dr. Williams, I'm so grateful for you spending the time with us this afternoon. I feel so empowered and rich with knowledge. I know you all have very busy schedules, so it's not something that we take for granted. And we hope that you will join us again if there are more questions, because I see them coming in. There's still tons of questions within the community, but this was so enlightening. I just want to share some of the key points that I wrote down, because I'm a nerd at heart. One is, health is the presence of wellness. That was a very powerful statement. Also, language matters. We should be asking the question, why are groups concerned about the vaccine, as opposed to passing judgment? We are building bridges not just for now, And this is an opportunity to think about how we can change healthcare for the future. The vaccine is highly effective for preventing hospitalization or death, right? I just want to emphasize that point. There was another important point that was made. The longer the virus remains in the community, the more chances of mutations and variants, and we might have to start all over again. And then finally, getting vaccinated is a community service. It puts us on the pathway to community immunity, and ultimately, it can save your life. So Drs. Williams and Dr. Iyasere, thank you from the bottom of my heart. We really appreciate you. To the audience, thank you for spending the time with us. We hope we were able to answer many of the questions that you have. If there are still questions that exist, please do not hesitate to contact us. Send them in and we'll try to get responses as soon as possible. We love you, we love our community, and we look forward to our continued work together. Thank you all.